it's Dr. Eric Ibebu with Atlantic Medical Group. Thank you for making the choice to have your colonoscopy at our center or have your endoscopic procedure at our center. We're excited that you've made this choice. Today, I want to talk to you about getting ready for the colonoscopy. This is one of the questions that we get most often in our practice is, how do I get ready? Well, this is it. There is no easy way to get ready for the colonoscopy, but I'm going to give you some good guidelines that I think will keep you as comfortable and make it as easy as possible. Number one, the day before your procedure. That's a big day. That's the day we call the prep day. That's the day you take the medication to help you prepare for the colonoscopy. And these medicines could be Go Lightly, that's one of the ones we use, or we can. You may have received a box called Easy to Go, which is a combination of medicine called polyethylene glycol and Docolax pills that you mix with Gatorade. You should have those instructions with you. But in case you don't, this is the instruction here. You take the entire 64 bottle of the powder, the polyethylene glycol or Miralax, you mix it with 64-ounce bottle of Gatorade, shake it up, refrigerate it prior if you like, or you don't have to refrigerate it. What other liquids can you mix it with, you ask? You can mix it with Powerade, you can mix it with Crystal Light. We have patients that mix it with plain water. We recommend those other things because of the electrolytes that they do contain. So that would be the better option. So on the day before the procedure, you're going to be on a clear liquid diet from breakfast, lunch, and dinner. Clear liquid diet means anything you can see through. If you can't see through it, it's not clear liquid. Milk is not clear liquid because you can't see through milk, right? So coffee, tea, certainly you can drink. Soft drinks you can drink. Water, of course you can. Fruit juices many times, as long as they are see-through, like apple juice or cranberry juice, you can drink those. And these clear liquid diets, it can be consumed throughout the entire day while you're prepping, so there's no restriction on how much fluid you can have. In fact, the more, the better. Now, no solid food. So that means no solid breakfast, no solid lunch, and definitely no solid dinner. You're going to continue your clear liquid diet all through the day, and your actual prep, where you take the medicine, usually will start around noon or around 1 o'clock. Frankly, there's no magic to when you start. The earlier you start, I always say, the earlier you finish. So if you start with your prep at noon, you start with the Docolax pills as we've already instructed you to. Then you follow up with drinking the liquids. Of course, be close to your bathroom because you're going to need it. And once your prep is done, you can continue with clear liquid diet and nothing to eat or drink after midnight. That's what we recommend. Nothing to eat or drink after midnight. If you wake up in the morning and you're super thirsty and you just don't think you can make it without drinking something, you can. We recommend not to do it no more than 2 hours before your arrival time. So if your arrival time at our center is 8 a.m., you can have black coffee at 6 a.m. You can take your blood pressure medicine, seizure medicines. You can take those type of medication or medicines for anxiety. You can take those type of medications with a small sip of water at least 2 hours prior to your arrival time. Now, this is very, very important because we do not want you to drink 30 minutes or be drinking any liquids while you are even at our center. We've seen that happen before, and sometimes it can lead to a cancellation or a delay of your procedure. We don't want you to go through all this process and have your procedure canceled because you are drinking in the parking lot. We don't want you to do that. So 2 hours before your arrival time should be the last time you have any liquids at all. Again, we are so grateful that you've made the choice to come to us to have your colonoscopy. And for those of you who are having just an endoscopy, meaning what we call an upper endoscopy, many times that does not require any prep. All you have to do is nothing to eat after midnight the night before, and that's it. But we're excited to welcome you. We have an amazing team of anesthesia staff, nurses, myself, and techs that are here dedicated to serve you and to help you and to make this a pleasant experience for you. So thank you for your choice with Atlantic Medical Group.